Warning: this video contains depictions of sensitive material that may be triggering for audiences. USET shares certain public health information as part of our function as a tribal epidemiology center and to make our broader audiences aware of emerging or concerning health-related issues.
We're here to walk you through the USET Harm Reduction Kit. This kit gives you the ability to save lives of those who are experiencing opioid overdoses from fentanyl. Fentanyl, and even its residue, is a substance that can be dangerous and responsible for many overdoses. Naloxone, which is included in this kit, is extremely effective at countering fentanyl overdoses and safe for people of all ages. In this video, we will demonstrate how to administer naloxone.
This kit contains 5 items: naloxone, gloves, a face shield, fentanyl testing strips, and a deterra bag. The deterra bag is an at-home drug deactivation kit that can be used safely to dispose of opioids and prescription drugs that you no longer use. All you need is water to deactivate the drugs. Fentanyl testing strips are used to detect fentanyl in substances. The instructions for these are included in their respective packaging. Now we'll talk about items that can be used during a suspected overdose. Naloxone, often referred to as Narcan, is a medication that reverses opioid overdoses, waking a person who has had an overdose within minutes. It does so by blocking opioid receptors in the brain for 30 to 90 minutes. Narcan is extremely effective. It is safe for any age. Yes, any age. And it does not cause harm if it is not an opioid overdose. This means that even if you are not sure if a person is experiencing an overdose due to opioids, it's still okay to use.
We often get asked, how do I know if someone is experiencing a drug overdose? There are signs and symptoms to look out for. Shallow breathing, blue lips, tiny pupils, and lack of movement are all signs of overdose. Overdoses are seldom immediate and often evolve over a 1 to 3 hour period. But fentanyl overdoses can be fatal within minutes. If you are present for an overdose, whether it's gradual or immediate, here's how you can respond. Before you approach, please have your PPE, gloves, and face masks ready to go. Remember, fentanyl, and even its residue, is a dangerous substance that can be harmful. Please, do not test the Narcan device before using it. Each device only has 1 dose. Now, let's talk about the steps to take during a suspected overdose. Step 1, get your gloves and put them on. Step 2, call 911 immediately. You want to be sure that the paramedics are on the way. Narcan only blocks opioid receptors for 30 to 90 minutes, so medical care will be required. Step 3. Shout, shake, and apply a sternal rub to assess if they are conscious or not. Step 4. Administer Narcan.
Now, let's learn how to administer Narcan. Put the person on their back with their head tilted back so that the Narcan doesn't run out their nose. Peel back the package to remove the device. Hold the device with your thumbs, protected by your gloves, on the bottom of the plunger and 2 fingers on the nozzle. Place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. Press the plunger firmly to release the dose into the patient's nose. Listen for a click sound. After you have administered the Narcan, place them in the recovery position. This will help prevent aspiration if they vomit. After completing these steps, the following may occur. The person may begin to breathe, but may not be able to get up. If that's the case, leave that person in the recovery position and continue to monitor them until the paramedics arrive. If the person has not begun to breathe, grab your face shield and do rescue breathing and chest compressions if you know how. If the person isn't breathing normally after 3 minutes, administer Narcan again. Alternate nostrils. There is no maximum dose for Narcan. You cannot hurt someone by giving them multiple doses of Narcan.
After you've done all this, there's one thing left to do: orient the newly awakened person. Explain what happened. Advise against using any drugs as Narcan will wear off and this could trigger a second overdose. Tell them that they may experience withdrawal symptoms for the next 30 to 90 minutes. And encourage them to see a medical provider. It is highly encouraged to stay with the person until they get medical attention. And that's it. You're done.
Actually, there's one final thing to do. Get another kit. And if you need a refresher on how to use your kit, you can always use the QR code included in the kit to rewatch the training. If you need resources or kits for your tribal community, please reach out to USET EPI at usetinc.org.